Welcome to this week's podcast. I am Isabella Watson, Workplace Relations Consultant here at VHIA, and I am joined by Senior Workplace Relations Consultant Tandis Ryan. Welcome, Tandis.
Thanks, Isabella. Thanks for having me.
We are talking about the changes to the Community Workload Management System clause today, which remains clause 60 in the new agreement.
That's correct.
Before we get started, the Community Workload Management System requirement is not new, is it?
No, it was first introduced in the 2016 agreement, but it has existed outside of the agreement since 2011, when the Department of Health published their Victorian Public Mental Health Caseload Management Standard 2011, following extensive consultation with the field.
So, what is the Community Workload Management System?
Basically, it is a requirement on the employer to not allocate direct clinical commitments to caseload team members of more than 60% of their time. This ensures that the workload for these employees remains reasonable.
And this hasn't changed?
No, it hasn't.
Could you provide an overview of what has changed?
The clause is predominantly the same, but there has been some changes, and these include from the 2024 changes. The first one is the facilitative clause to create or implement electronic system, and the second is the inclusion of process to allocate time free from clinical duty if employer is non-compliant with the 60-40 split.
Great. So let's start with the first change, the facilitative clause to create or implement an electronic system.
Yes. The clause reads as follows. Clause 60.1c, the parties will cooperate through the MIC to replace the existing CWMS, referred to at Clause 60.1a, with a generic electronic CWMS system as soon as practicable, and no later than the end of 2027.
So first things first, why develop a generic electronic community workload management system?
There are a few different reasons. Firstly, an electronic system overcomes the majority of the administrative burden that's associated with the tool. This saves employers and employees time. Secondly, those employers with an existing electronic system have demonstrated how the tool can be integrated into operations in real time. This substantially improves the value added to employers and employees.
And why a generic tool?
Members have done some great work in this area, which I am sure the department will want to leverage off. The use of a generic tool gives everyone confidence if the implemented tool is fit for purpose and ensures that no cost is associated with employees moving between health services, as they will already be familiar with how the tool operates.
So members may be interested in whether the tool development is funded.
Yes, it is. The department will meet the costs of its development.
Yeah. So the development of the generic electronic community workload management system is the first change. So what is the second change again?
The second change is the inclusion of a process to allocate time free from clinical duty if employer non-compliant with the 60-40 split.
Why has this subclause been included, Tandis?
The primary issue was ongoing non-compliance by employers with the requirements of the clause. Compliance was only about 20%. The unions made a number of claims to support compliance with the requirements of this clause. We would say that there are other challenges that were being experienced where the employee was non-compliant with the processes where the employers were trying to implement this. There are two factors that have been an ongoing issue.
And the clause does seek to address this?
It does. By providing an incentive for both parties to support the process, this will be greatly assisted by the department's support to creating the generic electronic tool.
Great. So let's look at the subclause.
The change is located at subclause 60.80. The first part is unchanged, other than the heading, which was entitled Grievances in the last agreement. Clause 60.8, non-compliance, reads as follows. Part A, in the event an employee's workload is not compliant with this clause, the employer will take immediate steps to adjust the employee's workload to ensure compliance.
And that takes us to the changes.
It does. So subclause Part B, from the commencement of this agreement, where the employee's workload remains non-compliant within 2 months after the completion of the monthly reporting period, the employer will take the following immediate steps. Roman numeral 1, the employee will be rostered 1 clear day from direct clinical care, which is non-direct clinical time, during the next reporting period. And Roman numeral number 2, the employee will not be allocated to any additional cases that will increase column A activity until such time the employee's workload meets the 60/40 threshold.
Great. The first thing to note is that the change takes effect from the commencement of the agreement.
That's right, Bella. But that should not be a problem, as members have been required to have this system in place for the last 10 years. Members should, however, review their arrangements to make sure that their system is capable of delivering the required information on time. Any gaps should be urgently addressed.
It seems that the new subclause is really about prescribing the steps to be taken at subclause 60.8a if the employer should find themselves non-compliant with the 60/40 split.
That's right. In the event the employer is non-compliant with the 60/40 split and continues to be non-compliant for a further 2 months after the end of the reporting period, then they must, firstly, there is a roster 1 clear day free from direct clinical care, which is non-direct clinical time, during the next reporting period. And secondly, to not allocate any additional cases until the employee meets the 60/40 threshold.
So why roster the day free from direct clinical care?
That day will add to the organisational time for the next reporting period and therefore work towards the employee returning to a 60/40 split.
And what does the employee do during that time?
The employer is still responsible for allocating the employee with duties. The only restriction is that they cannot involve direct clinical care.
So is the employer limited by how many days free from direct clinical care?
No, the employer may elect to allocate additional days if they choose to, but these will not count towards the obligation to roster a day in the next reporting period.
Okay, and the other action is not to allocate any additional cases until the employee meets the 60/40 threshold?
Yes, specifically where this has the effect of increasing column A activity, this stays in place until the employee is compliant with the 60/40 workload split, which may at any time either before or after the end of the reporting period.
The next subclause has the effect of reducing the 2-month period down to 1 month. Why is that?
It does, and it does read as follows. So Part C of that clause is that the period of time referred to in clause 60.8a will reduce to 1 month following the end of the reporting period once the electronic reporting tool referred to in clause 60.1c is implemented. Once the generic electronic CWMS system is in place, there will be no delay between the reporting period ending and the data being available to the employer, hence the reduction in the time period. This data from the electronic CWMS system will actually likely be live so that the employer can adjust workloads in real time even before the end of the reporting period. This is how it is operating for those health services already using one. This dramatically decreases the likelihood of clause 60.8 having any work to do.
So that takes us to subclause 60.8d.
Subclause 60.8b will not apply where Roman numeral 1, the employee does not complete the tool. Roman numeral 2, the employee has been on periods of absence that distort the reporting results. Roman numeral 3, the WIC, through consensus, provides an exemption to the obligation at clause 60.8b, Roman numeral 2, to a specific area in writing for a prescribed period of time. The purpose of the first 2 points is to address the circumstances that are likely out of the control of the employer to ensure that the penalty is not applied in those circumstances. The third is really a safety mechanism inserted to ensure that there is a release valve if the clause does not operate in all circumstances as expected.
Great. So that takes us to the lucky last subclause.
Which is Part E, workload will be assessed at the same point each month. This is really common sense, but important to note. It should also be noted that the employer will likely not want everyone to have the same reporting period dates so that they can manage the workload for the manager, but this will need to be addressed locally based on what best suits the employer's circumstances.
Yes. Thanks for taking us through, Tandis. Do you have any final tips for employers?
I do, Bella. My final tip would be to review your CWMS systems as soon as possible and to make sure that it will deliver the information you require when you require it.
Yes. Thanks for taking us through the changes to the Community Workload Management System clause in the new mental health agreement.
Thanks for having me.